Good morning, everybody, and thank you so much for this invitation. I'm very delighted to be here amongst you and talking on a very important topic, that is what are the opportunities to improve the food systems in the country. So let me start with the issue. Issue is that we are having lot of burden of different kinds of malnutrition. I won't say only undernutrition, it is undernutrition, vitamin and mineral deficiencies, which is micronutrient malnutrition, and rising burden of overweight and obesity. So I would say that each age group in the country is afflicted by one or the other form of malnutrition. And that's really an issue which really need to look upon. So why this issue is here in our country and why we are not able to tackle, that's really a point to ponder on. One is that the issue of the nutrition outcomes is very, very complex. It's just, I won't say that diet is the solely one factor which is responsible. It is the complex action of diet, our healthcare system, as well as the lot of underlying determinants which are related with the socio-economic conditions, even the political commitment. So everything altogether actually determines the nutritional status of the population. And therefore, I think it is always being very difficult to say that one thing is attributed to other in very simple language, in a linear relationship in terms of nutrition outcomes. We always get very weak relationship whenever we try to talk about any research on nutrition. So to deal with one of the factors which is like a major determinant of nutritional outcome is certainly diets. And for, I think, long time, the focus was on all the global as well as the national policies, focusing on actually addressing hunger, right? Addressing hunger, addressing undernutrition, focusing only on children and mothers. So I think there is a lot of, and at the simultaneously we were having this increased level of overweight and obesity, which was not being addressed so far that way, and we didn't thought of having a diet and nutrition actually optimize it to address this whole of the triple burden which we are talking of: undernutrition, micronutrient deficiencies, and overweight obesities. So in 2021, the United Nations Framework for Food Systems actually brought this renewed focus of everyone globally on the healthy diets, and healthy diets to address all forms of malnutrition. So that is why now everywhere we are not talking about addressing only hungers. We are talking about promoting healthy diets now. So promoting healthy diets requires, it's again a very complex system, because we have to go back right from the production to the consumption. So the cycle actually comes in when we talk about having a healthy diet. Lot many sectors need to work on to make it happen. And globally, if we see, there are few examples which actually have been successful, not only in terms of making healthy diet, but making some progress. So coming from the example from the Brazil, if we see, so cash transfers, school nutrition, and agriculture subsidy altogether actually were able to bring down poverty as well as improving the nutrition outcomes. So that was, of course, it took a lot of time, but this is the kind of one of the global examples. Similar examples came from Mexico, or as well as to some extent from Thailand as well. So these are countries like us, which are low and middle income countries, and also actually struggled with lot of undernutrition, but actually able to bring down that level considerably, and this actually provides us hope that actually it is possible. It is possible to implement something with the help of the different stakeholders. Now, if I come to the next part, what is happening in India and what is the policy scenario? So in India, if you see nutrition policies, if we see, and all social development sector policies, we have a Poshan Abhiyan at the center, which is kind of really focusing on the improving nutrition outcomes. But to support that, we have Swachh Bharat Abhiyan, because sanitation and hygiene is closely related with our nutrition outcomes by addressing the infectious diseases and the related malnutrition, not only in children but in adults as well. We are also having policies which are promoted to generate livelihood for the women. So livelihood mission, which actually talks about creating self-help groups for the women, it actually helps not only in generating income, but also provides very strong platform to disseminate these messages to the women. And successful pilots shows that this is possible. UP BMG has conducted a pilot study using these self-help group platforms to disseminate these messages of health and nutrition, and it was quite successful. And similarly, the larger scaling up is happening in Bihar currently in the same manner. So these are the lot of hope which provides us that different actors can actually come together and work for the improvement of health systems. If I go next with the health has a two important health and as well as the Women and Child Development Ministry has a two important platforms available at the grassroots in the country, which is one is Anganwadi Center and second is Village Health and Sanitation Nutrition Days, which are celebrated. So Village Health Nutrition Sanitation Day is a convergent day where both Anganwadi workers, Ashas and ANMs are sitting in the village, and they can actually deliver the services, and they are delivering the services. This provides us again a very important platform to how we can actually intervene at the local level by using these platforms. Anganwadi Center's primary responsibility is nutrition. They are responsible for delivering supplementary nutrition to the women, pregnant women and lactating women, as well as children under 6 years of age. When we are saying Anganwadi centers are dealing with supplementary nutrition, that means that is the one platform which provides us potential to do a lot of things with the food which are being given to the children. So take home ration, which is given to the younger children and women, can be so lot of innovations, pilots have been done to include millets in that, so increase their nutritive value. Also, a hot cooked meal which are provided to preschool children of 3 to 6 years. Lot of pilots have been done to improve the nutrient content by adding just local vegetables, egg or milk. So that actually is a real direct intervention at the bottom level, which can has a potential to improve the food habits of the population. The third thing comes as the very important platform is the school health midday meal program, which is one of the largest feeding programs of the country, which is actually directly feeding children, providing one meal to the children. Again, this is an important platform which can help improving not only the diets of children, but also the awareness level, their eating habits, also the food hygiene. So many things are possible. I just want to give you examples like In Anganwadi centers, in the schools, now Nutri Gardens are promoted. That's a direct, Nutri Garden is not a nutrition intervention, but actually horticulture and the vegetable growing intervention, which can actually not only helping children to know about the food, but also using this homegrown food for to make their own own food and vegetables in the meals. So this is really, and similarly the another one very important example, lot of schools are now using solar energy as a green energy initiative for the in their kitchens. Again, this is another example of integration, how the different sectors can work together. Hand hygiene and washing, simply by telling every child that you should wash your hand before taking meal, is actually a habit forming initiative which can stay lifelong. My last point comes when we are talking about whether we are talking about lot of system-led initiatives. What about communities? We need to work towards communities. Community need to own this. Unless community is convinced that this is for good for us, then people will start adopting it. People do adopt local innovations. There is a slight change in their recipes or some intervention to improve their crop pattern, that can be very, very helpful. So I am not suggesting any solution here, but I'm just opening up this dialogue on how more and more people can be actually joined in this. CSR groups are already working, and we need lot of contribution, not only from the academia and the nutrition professionals and the agriculture professionals, but we do need lot of contribution from industries, digital innovations, agriculture innovations, as well as the innovations in the other foods like poultry. How do we increase the protein quality of the diet? Can we have something on marine foods, which is like a very large portion of our population is consuming? So it opens up lot of opportunity, and I feel that food system is not only one's responsibility or government's responsibility. It everybody's responsibility if we really want to go. Thank you so much.